Guys, we're live.
Hello and welcome to the debut of our new Facebook Live series, Ask the Vision Loss Experts, Coping with COVID-19.
One more time, I'm sorry.
Hello and welcome to the debut of our new Facebook Live series, Ask the Vision Loss Experts, Coping with COVID-19. My name is Dr. Tricia Grant and I am the Senior Director of Low Vision Research at the Chicago Lighthouse.
Hello, everyone. I'm Dr. Bryan Wolynski. I'm a low vision optometrist in New York City, and I also work with and consult for OrCam Technologies. Our intent here is to discuss, share information, and just bring up topics about things that pertain to living with vision loss during this time of COVID-19 and social isolation.
And we welcome everyone to join. So whether you or a loved one are a person who is visually impaired or blind, or you just want to learn more about the experiences of people with vision loss, we welcome you to join us every week during this time of social distancing.
So Dr. Grant and I met, so everyone just understands how we kind of created this. And in the past, we met before what I like to call pre-corona times. And it was through a collaboration between OrCam Technologies and the Chicago Lighthouse. And we found out a lot of the work we do is very similar, and we shared a lot of the same passions for assistive technology, for low vision rehabilitation, public health, and also as both of us being an advocate for people who are blind or visually impaired.
That's right. And then during those times, it's really interesting because you and I were both going into the clinic every day and we were having conversations from our office. And then the coronavirus hit and we were quarantined along with everyone else into the home. And fortunately, we continued our conversations and we found out that we really both wanted to do more. We wanted to put our heads together and be a resource to the community. So here we are today. And when we first started promoting this, some of you may have seen the promotions earlier this week, but we asked people to send us your questions because that's why we're here, to be your resource, and we want to answer your questions. So we did get a ton of questions. We're very thankful for that. And, let's get started.
Sure. So actually, we did get some pre-questions beforehand. And so we're just going to read them out to everyone. And hopefully some others have questions during when we're talking. So hopefully we can answer them. But a really good one that we thought was, what are some good apps to use for grocery delivery? And what are some tips for managing my deliveries?
Yeah, I think
so I don't know if you want to get into that, Dr. Grant.
This is a great question. First of all, it's really, it's great that you're staying, keep sticking with the device. The advice, and you're staying at home. And remember, you're doing that not just for yourself, but for everyone. So it's really great that you are doing that. But you're right, you need your essentials, you need your groceries, prescriptions, and other things. So fortunately, there are some really great grocery store apps. And the two that I'm going to recommend that I know are accessible for people who are blind are Instacart and Shipt, and that's SHIPT. And both of them have platforms that are accessible on iOS and Android. And you just go on the site and you do all your shopping right there on the app, and you can add things to your cart, and then they deliver them right to your door. So what you want to be mindful of, in the past, they were delivering them to your door, or they might even come inside, the delivery people, but now they're doing contact-free delivery. So that means that they're either going to leave them outside your door if you're living in a house, or if you're in an apartment or a condo building, they're going to leave them in a common area. And that's, again, for your safety and theirs. So you want to make sure that you understand that you are going to have to go outside just a little bit to go pick up your groceries, and you want to make sure that you're following all of the quarantine rules, and wear your mask, wear your gloves, even if you're just going to your lobby. And then when you bring your groceries in, just disinfect everything. That's really important before you're putting them away.
Well, while these apps are great, I mean, it's good information that we know it's out there. I do have a friend that uses the apps, and while they're accessible and that's wonderful, it's that unfortunately there's a lot of wait times, and it's hard getting a time to get a delivery. I have my friend who was he does it on a normal basis during pre-corona times, and he woke up at 3 o'clock in the morning to try to find a scheduling time, and he couldn't for over the next 2 weeks. So that can be a difficulty using those apps. What he's done is, thankfully, someone who's a friend of his in the neighborhood is, when they go shopping, they're asking him for a list, they're bringing it, leaving it in front of his door, and then he's wiping things down with the disinfectant wipes and bringing it in. So that was his solution for that. You can check, I know here in New York City, there's a new group that just started called Invisible Hands, and they're a volunteer group that helps with delivery. So unfortunately, while these apps are great and they are accessible, they're just inundated, I think, right now with deliveries. So it's a little difficult. You might get a time. But Dr. Grant, you mentioned to me when we were speaking about a patient who went to the grocery store and had a little difficulty.
Yeah, so one of my friends who is blind, he was telling me that he was going to the grocery store with his wife, and this was kind of his way just to get out a little bit and walk around. But they issued an ordinance in his county where it was 1 cart per person. So that means that there's only 1 representative from the household that can go out. So it just eliminated his ability to get out. It's honestly probably safer that he's not going to the grocery store, but it's just unfortunate that people who do have disabilities and who need some guidance when they're going to the grocery store were not taken into account for this ordinance. So as you mentioned, though, I think that people, if you are someone who's watching and you are going out to the grocery store, maybe check on your neighbors, see if they want to give you their order and you can go pick it up for them.
No, that's good advice. Let's get on with some more questions. What else do we have?
Yeah, so this next question, this comes from Julie Hall from Chandler, Arizona. And she says, I live alone and not that great with technology. I'm on Facebook and some other social media outlets, but what else can I be doing?
Well, that's really also a great question. Really at this time right now, it's a good time to think about assistive technology. If you have any assistive technology around you, and if you're not any really good with it, it's good to take the time to learn it, master it, learn it and use it, sort of learn it to the point of where you're going to teach someone else how to use it. If you don't have any assistive technology, it's a great time to research as well, going online and seeing what is available out there for you. One of my patients actually told me a really good line. Our patients teach us so much every day, all the time, and said to me this one comment that I use all the time: assistive technology is very personal. And so even when we're not home, socially isolated like this, it's really about researching, finding what's for you, finding the right thing, getting a really good demonstration. Places like the Chicago Lighthouse, I know, has a lot of assistive technology that people can try out. I know that there are a lot of online demos now. And even if you're, I work for OrCam, if you're an OrCam user, now's the time to pick it up and use all the different functions and abilities that it has. And like I said, master it.
Yes, I agree. So assistive technology is so important right now. And Julie mentions that she's only on social media, and I wouldn't discount social media right now because, a couple months ago, it was a place where we can connect with our friends and show pictures and share our thoughts. But now it's really become a real hub for information. So if you are interested in technology, I would recommend going to the company's website and see what they have to offer, because everyone is putting out, demonstrations and videos more than ever before. And if you can't find what you're looking for, you can contact us at the Chicago Lighthouse. We can put you in the right direction, or we may even have the videos that you're looking for and the demonstrations that you're looking for.
Yeah, I have a good friend also who's using, right now he's learning like a lot of different things on his computer, and it's working out really well for him. So it's time to, like I said, research and just try things.
I agree.
So I have a question here, meaning more towards social isolation, which we are all going through in these unprecedented times. But someone asks, social isolation is making me feel depressed and anxious. How can I cope with these feelings? Really important question.
Yeah, this is such an important question. I'm really happy that someone asked this. First of all, it's really well known that people who have vision loss are prone to depression. They're 2 times more likely to be depressed than someone who doesn't have vision loss. So that, coupled with all the stressors that we're encountering right now, we miss our friends, we're all worried about our health, and are we following these quarantine procedures correctly? We may have someone that we care about who's sick and we're really worried about them. So all of these contribute to depression and anxiety. So first of all, know that you're not alone, and it's really normal to feel like that during this time. And in one of the upcoming episodes, we're going to bring on a clinical psychologist to offer the clinical perspectives of coping with depression and anxiety. But right now, I'm just going to offer some tips that could help with taking care of your mental health, which is so important right now. And one of the first things I recommend is stay connected to your social network. Don't underestimate the power of a phone call, or even if it's just for a few minutes. You want to stay connected, and there are some really great ways to stay connected right now. You can use apps like FaceTime if you're on an iPhone. You can also use Zoom, and House Party are another ways to stay connected. And then you want to try things individually. If you don't have a big social network, that's okay. There are things that you could do on your own. So you could try meditation. And if you talk to anyone who does meditation, they swear by it. It really works. I'm, dabbling in it a little bit myself, but it is very helpful. Another thing you could do is yoga. And right now, if you go to OrCam's, well, not right now, but after our session, if you go to OrCam's Facebook page, you can see Lena Lee, and she is offering descriptive yoga for people who have vision loss. So whether you have visual impairment or not, I recommend joining in. These are really great sessions. And then just try things like music and podcasts. I'm a big podcast person, and podcasts are doing a lot right now to lighten the mood. They're kind of changing away from like news and information to more like comedy and storytelling, and it's really great. So that's another way. And then this suggestion comes from Brooke in Chicago, and she recommends Audible. And Audible is a place where you can have books read to you. And right now they're offering free subscriptions for children. So Audible books are free for kids, up until this quarantine's over. So that is really great. Thank you, Brooke, for that recommendation.
No, thank you, Brooke. That's great. As a low vision optometrist, when patients come in, a lot of my low vision patients are telling me already they feel socially isolated. I've had many patients even say they feel like a prisoner in their own home. But this, takes it to the next level. And depression, anxiety is all too real right now. And, with depression, we've all been, about a month doing the social isolation thing, feeling the blues, a little anxiety. It's very normal. I mean, I think a lot of us are also going to have issues with OCD afterwards. So we're going to need a lot of help from professionals. So I'm glad also we're going to have a clinical psychologist coming on here and talking with us and giving some information. And those are kind of the things that we want to bring to everyone. But more importantly, if you're feeling, something more than the blues, and it's an everyday consistent thing, depression can creep up on you. We need to have that little mental health check, and, give a therapist a call, or call places like Chicago Lighthouse in your area. Hopefully, or most likely, they do have a psychologist on staff, and hopefully they can be able to help. Call family, call friends. If you don't, again, a therapist. It's not a bad thing to do. It's a positive step.
Yes, I agree. So here is the next question. This is a good one as well. I haven't been outside in weeks, but I'm considering going out for a walk. What are some things I need to consider?
Well, there's a whole bunch of things to consider about taking a walk. So I actually work at the University Eye Center here in New York City, and I see emergency patients 2 days a week, routine care we're not doing. But really what you need to consider is your safety and concern. I would, recommendations is to stick around your neighborhood. One thing for cane users, what you need to be careful of, if someone is seeing you walking, and we had actually an OrCam user I spoke to this week who mentioned that he was using his cane, he was about to cross the street, and someone came up and grabbed him and tried to bring him across the street without asking, without attempting. He's very capable, very independent guy. He's been using his cane for years, and now it's great that people want to help, but people really, just like petting guide dogs, they need to know that that's not something to do when the guide dog's working. Well, it's also the more proper thing to do is ask somebody if they need help first. So be careful about people trying to come up to you and trying to help, whether you have a cane or not have a cane. Just people want to help. People want to do those things today. So what I would suggest is stay within your neighborhood. Hopefully people know who you are in the neighborhood. Maybe walk with a friend or a neighbor. Keep that social distance, that social isolation about 6 feet away. And that way you're staying safe in your neighborhood. So those are some things just to be kind of aware of.
Yeah, those are great.
What have you heard?
So yeah, I agree with you. And I think following the same guidelines that we're all following. So if you're going to go outside, wear your mask. Make sure you're washing your hands constantly when you come back inside, and stay distant. And for someone who's using a cane, you can actually use that cane as a ruler to measure. I think the length of a cane is about 5 feet. So, no one should be.
Or you could just take it and, tell people to get away from you, when they're congregating.
Yeah, I would say, don't feel bad if you have to tell someone you're too close. If you detect someone's near you, and just, let them know you're too close, and it's okay. I've personally had the experience when I was at the grocery store. I spotted something on the shelf that I really wanted, and it was the last one. And I did honestly lean too closely. And, the woman, she didn't say anything, but she just gave me the look that let me know to back up. And I didn't take offense to it. It's, we have to be reminded it's not common knowledge or just second nature for us to stay 6 feet from someone. So if you have to remind someone, don't feel bad about that. And then lastly, be sure to disinfect your cane when you come in.
Oh, definitely. Yep. Wash your cane, wipe your cane tips. We have another question actually that I'm reading off my phone here. So sorry about that. This is a new one from Andy Fabino. Hopefully I'm saying that right. He says for self-isolation, self-help, is there a way you can talk about easy workouts that a blind man can do? So actually, I'd like to just answer that real quick. So actually, OrCam just yesterday did a sort of a workout session with Tyler Merrin, who is a Paralympian athlete and trainer. And it was a great session. And he did sort of workouts that you could do at the home. He, some things are maybe a little more advanced, some things are less. And really, he mentions is if something's too hard for you, you just need to change how you do it and make it easier for yourself. But he's doing it every week, and I believe that's on Wednesdays, and you can check the OrCam website. And I believe the session that he did yesterday is still on there. Or, if you're like me, I get lazy watching TV for an hour. Try to remember also to get up every hour or two, take a walk around the house. Hopefully, if you have a yard, take that. I'm in a little studio in New York City, so maybe I got to do 20 laps around the studio, and that's about it. But there are things you could do. I suggest something like that with Tyler. It was a great session. Even yoga. So we mentioned earlier, Lena Lee from OrCam as well is doing a yoga session. It's great. I was actually at my working at the emergency care center where I'm working, and I did yoga in my chair. So, so it's possible to do anything while sitting or running or doing anything.
Yeah, and one of my friends, because we're constantly talking about physical activity and not being able to get enough of it, and one of my friends just said something really simple, and that was to just go back to the old school way of working out. So think about for some of us, what did our PE teachers ask us to do when we were younger? And it was just things like sit-ups and jumping jacks and squats, and all things that only require your own body weight and just a small area to do them. So just challenge yourself each day, increase. If you do 20 jumping jacks one day, do 40 the next day or the next week, depending on how actively you're working out. But yeah, there are definitely ways. If you have a couple steps in your house, you want to carefully, go up and down the steps. And again, challenge yourself with how many minutes you're working out. So there are a lot
I only have 2 steps.
I
only have 2 steps.
You can do a lot in 2 steps.
I go up and down a lot. Sure, I can. Actually, we have, I'd like to send this question to you, Dr. Grant. Robin Whalen, who I know very well. Thank you for joining us, Robin. And also for anyone else joining us, I'm Dr. Wolynski. This is Dr. Grant. She's from the Chicago Lighthouse. I'm with OrCam and a low vision optometrist. And we're just bringing information and trying to engage everyone to talk about living with vision loss during this time of social isolation and COVID-19. So Robin, hello Robin from Missouri. One of the biggest stresses is knowing, at least here, testing sites, so testing that are all drive-through. A lot of restaurants are curbside pickup, and they get mad if you walk up. Same with banks. Any suggestions on what we should do about this? So I guess like walk up restaurants, or what can they do about that?
I think we need to spread awareness and let people know, because as I said earlier with the ordinance about the grocery shopping, some of these rules are not considering people who do need to have physical contact with people when they're picking items up. So that's part of why we're here, is to spread this awareness. And we ask that you do that as well. I mean, if someone is getting upset about you walking up rather than driving up, I would just, inform them, because most likely they're not considering, other issues that would, cause you to want to walk up and pick something up. So just continue to spread awareness, be the voice for the community, as we will as well.
I think everybody's learning as well as time goes on. I mean,
Yeah.
a lot of things, unfortunately, in the visually impaired and blind community have been left out also, just to bring up. I mean, when they started testing, they said, oh, drive up with your car. I mean, that left out people with disabilities or anyone else, stuck at home. So everyone's learning as they go, and hopefully solutions are coming. And like you said, Dr. Grant, is be the voice, bring these things up. We have to make it known. This is where advocacy comes from, and it comes from the grassroots. Definitely. So let's get to another question. All right. Let's see. I got one for you also, Dr. Grant, that I think you wanted to tackle. How can I stay socially connected? I think we touched a little on that, and entertainment at home.
Yeah,
so you mentioned about Zoom.
Yeah, I mean,
and accessibility.
We all love a good Netflix and chill night, but that gets old, and you don't want to do that every night. So there are some other ways to do it. We just talked about Zoom, and there's another app, House Party. And you don't have to just talk during these calls. You can sing together, play games, do fun things. You can cook together. If you you maybe want to try a new recipe and you don't have a lot of people to eat it, you can just freeze it. So don't worry about having too large of portions. Just stay really connected. Another really great thing that was recommended by Brooke out of Chicago, who has really great recommendations for us. She recommended a book club called Now Read This. And this is, they have a Facebook page. So they assign a book, and then you have to read your chapter a week, and they are posting questions every day. So you can engage in some conversation, some meaningful conversation around what you're reading. And if you don't like socializing with strangers, that's totally fine. You could start your own book club. And my friend Andrea started a movie club, and she is letting us know, we're all selecting which movie that we're going to watch, and then we're going to talk about it on, on a video chat. So you have to be really creative. It's a great time to be creative, but band together, just stay connected.
And mentioning things like we're on here, streaming and live, there's a lot of accessibility with Zoom. So if you want to stay in contact with people, and if you don't know how to use Zoom, there's a lot of videos, there's online help for that, but it definitely is an accessible platform if anyone wants to know that out there.
Great. So here's this is a really important question. I have an appointment with my eye doctor next week, and I haven't heard from anyone yet about confirming. What should I do?
So it really depends on what your eye appointment is for. Right now, eye doctors, ophthalmologists, optometrists, or anyone in eye care professionals are not seeing routine care. However, they are seeing emergency and urgent care. The American Academy of Ophthalmology actually has set forth guidelines for ophthalmology as well for any care that's needed. Now, if you're undergoing any current treatment, such as injections for macular degeneration or your diabetic retinopathy, I mean, it's important to keep up with this. But what I recommend is calling your eye doctor. They either have the calls forwarded, or they have someone answering, or an emergency services line, and asking, is my appointment still on? When do I need to come in? Because most likely they're also going to be staggering appointments, so many people are not in the office at once. So most likely you will be contacted, or contact them to find out if you need to go. Another important thing is keeping an eye on your own vision. If you feel something has changed, flashes of lights, floating dots, decreased vision, a change in your vision. If anyone has that Amsler grid, which are those little lines crisscrossing, and you see a distortion in your Amsler grid, call your eye doctor. That could be an emergency situation. Other things is a lot of people are now doing telehealth. They possibly may be able to just get with you online and speak to you, sort of how we are all speaking. So that could be well. I know you mentioned, Dr. Grant, that the Lighthouse, I believe, is doing telehealth as well.
That's correct, yeah. The Chicago Lighthouse is offering virtual low vision care. So that includes optometry, psychological services, and occupational therapy. And we're also working on offering some virtual orientation mobility. So I would encourage that you reach out to your office. I mean, as the shelter-in-place orders continue, we are becoming more creative and figuring out ways of how we can offer some of these virtual services so that people are still getting the care they need. So again, if even if you talk to your eye care doctor 2 months ago, reach out again today to see if anything has changed, because things are changing weekly.
Yeah, I'd seek advice. Again, don't just think by yourself too. I've had a lot of people come in, I had one person saying, oh, vision decreased in one eye 2 weeks ago. Don't wait 2 weeks. Don't say, oh, maybe it'll get better. Get on it right away. There are people out there to help, and there are safety precautions that are taken in offices. So like I said, the American Academy of Ophthalmology has put guidelines out there. Just make a phone call. It's easy.
Yes, I agree. So we have one last question here. I'm pretty well adjusted to the quarantine, but I know others may be having difficulty. What can I do to help others?
I like that one because we all feel like we want to do to help others. I feel compelled to help everyone, but what's important to remember at this time, it's sort of like when you're in an airplane and the oxygen, they have that thing with the oxygen mask comes down. What do they say? They say, put the oxygen mask on you first, then help someone else if they need assistance. And really the most important thing is, yes, take care of yourself first, because if you're not well, then you can't help other people. And if you are well, that's great. And what can you do to help other people? Well, you can reach out in your community to see where you can help. Possibly it's even maybe making a phone call to people who are lonely, people who are depressed. Try to reach out to family and friends. That way you can help. And you are helping by staying home and letting the essential workers be out there and do their job. If you're really good with assistive technology, maybe you could teach people how to use assistive technology. Give your local organizations a call, like the Chicago Lighthouse, and see maybe where you can be of help. Or it's just reaching out is a great thing.
Yeah, I agree. That's some really great advice. And I think it's wonderful if people are learning how to adapt to the quarantine. And, I think one of the silver linings in this situation is that people are really extending kindness to one another and checking on people. And I think that's really important. And, a couple of my friends have even sent me quarantine gifts, which has been really nice, just like little pick-me-ups. So that's nice. Yeah, it's really nice. It's just a little way to say I'm thinking of you, and I hope you're okay. And again, reach out to people, stay connected. That's, to me, the most important thing.
Exactly.
So, yeah, we've had some.
I think that was all.
Yeah, that's it. We've had great questions today, and we want to thank everyone who contributed today to either asking questions or helping us with these answers. And we encourage you to please keep coming back and joining us. We're going to bring on some pretty interesting guests. We have a special guest joining us next week, which we'll announce either later today or tomorrow. But yeah, just come back. We're here as long as this quarantine is going on. We're going to keep coming back. So let us know who you want to see and what do you want to know.
Yeah, again, we're here to just bring discussions and bring topics, and hopefully you've enjoyed today. I've enjoyed working with Dr. Grant on this, and hopefully more collaborations will come out of it. But really, just wishing everybody well, wishing their loved ones well, stay safe, and just always remember, wash those hands and don't touch your face. Thank you.
Thanks.